It is extremely important for us to note that African Americans and other races and ethnicities have participated in the clinical trials, but they've also helped to invent the vaccine. And we have had multiple scientists and physicians and pharmacists and others from different ethnicities reviewing and approving both the data as well as the efficacy of this vaccine.
Members of the Black Coalition Against COVID have been intimately involved with oversight as it pertains to the COVID-19 vaccines.
I think that our participation in the vaccine development, our participation in vaccine trials, our participation in the rooms where decisions have been made, and the transparency of such will hopefully lay a foundation for how inclusive science actually looks, and that this will go a long way to building the trust that we need between underrepresented minority communities and the health system at large.
The death rates related to COVID-19 for the Black community is nearly 3 times that of the white community. In regards to hospitalizations, it's nearly 5 times that of the white community.
This vaccine, when you weigh the situation that we're in at this time, we do nothing or we accept the efforts that have been put forward for us to survive and to help others survive.
If the Black community sits on the sideline, whereas other communities are more readily available or readily willing to receive the vaccine, that difference in outcomes is just going to worsen. And we don't want to see that. We want to see that gap of health outcomes closed and to promote wellness and well-being across our communities.
One of the things that I keep hearing in the community is, can the vaccine actually give you COVID?
It's actually not possible to get COVID-19 from any of these vaccines because they are not using live virus.
I know personally, though, having participated in the clinical trials, I had very minimal side effects, was able to continue to work, without any loss of time or downtime, and have felt fine ever since. Some of the short-term side effects that we're hearing about, perhaps pain or redness at the injection site, fatigue, muscle aches and pain, joint pains, and perhaps headache.
When one develops these short-term symptoms after receiving the vaccine, that in fact is a sign that the vaccine is working and that your body is marshaling its defense network.
The COVID-19 vaccine will be available to everyone in the United States at no cost to the consumer, whether they have insurance or not.
The COVID-19 vaccines that will be administered over this next year, they've already been paid for. Now, there may be some type of administrative cost associated with them that should be covered by insurances. I would be guarded if one is being charged a high amount to receive the COVID-19 vaccine. I think it's important that we look at this holistically. So the vaccine is important and it's a protective measure. Wearing a mask is important also. Physical distancing of 6 feet is important. Washing one's hands for 20 seconds is important. So it's the whole plate of options to help protect our community.
The 3 W's: wash your hands, wear your mask, and watch your distance.